Welcome to the AIDS Awareness Disc. This program asks 100 questions about HIV and AIDS. Don't worry, you probably won't know all of the answers when you start, but by the time you've completed the program, you will be AIDS aware.
What does AIDS stand for? Autoimmune deficiency syndrome, ancillary immune depression syndrome, acquired immune deficiency syndrome, active immune disease syndrome. No. AIDS stands for acquired immune deficiency syndrome.
What is HIV? A disease? A virus? A bacterium? A parasite? That's right. HIV is the virus that causes AIDS.
Which of our body systems does HIV attack? Muscular system, immune system, cardiovascular system, respiratory system? Correct. HIV directly attacks the immune system, weakening the body's natural defenses against infection. The weakened immune system lets opportunistic infections such as pneumonia and some forms of cancer take over. When the immune system is severely weakened, the patient is said to have acquired AIDS. How can you protect yourself from HIV and other sexually transmitted diseases? Use a condom, use a diaphragm, use birth control pills, any of the above. Good. You can protect yourself from HIV and other sexually transmitted diseases during sexual contact by using a condom. The condom and the dental dam are the only physical barriers that have been shown to prevent transmission of the virus. Which condom should you choose? Natural membrane condoms, latex condoms, lambskin condoms, any of the above? Perfect. For the best protection, use latex condoms. Lambskin or natural membrane condoms don't provide protection against HIV because they contain tiny pores or holes. Always look for the words latex condom on the package when you purchase your condoms.
How effective are condoms at preventing the transmission of HIV? Almost 50%. Almost 70%. Perfect. Although they're not quite 100% effective, condoms are near perfect if they are used consistently. When condoms fail, it's usually because they are handled wrong or because they aren't used during every sexual encounter.
In a study, 123 people used condoms when they had sex with an infected partner. How many became infected? 100. Good. In a 2-year study of 123 healthy Europeans who used condoms every time they had sex with an infected partner, none became infected themselves. Although condoms aren't 100% effective, they can be very, very close if used consistently. When they fail, it's usually because they are handled wrong or because they aren't used during every sexual encounter.
What is the best lubricant for condoms? Baby oil? Petroleum-based lubricants? That's right. Only use water-based lubricants. Petroleum-based products actually break down the condom and can allow leaks or breaks to occur.
Can you get HIV from kissing? No. Perfect. It has been known for years that a small amount of HIV may be present in the saliva of some infected people. However, the amount of HIV in saliva is much less than in blood, semen, or vaginal fluids. So, even French kissing has little risk for transmitting HIV.
Can you get HIV from oral sex? No. Only vaginal or anal intercourse transmits HIV. Only if your partner has an open sore. Yes, oral sex can spread HIV. Correct. Getting semen, vaginal secretions, or blood from an infected person in your mouth puts you at risk of HIV infection. The risk is not as high as from anal or vaginal sex, but it is still there. Sores or cuts anywhere in your mouth would make oral sex even more risky. Can you acquire HIV by donating blood? Yes, the needle. Good. There is absolutely no risk of getting infected with HIV by giving blood because a new, sterile needle is used for each blood donation.
A girl sneezes while scooping your ice cream and you find out she's HIV positive. Are you at risk? Yes, HIV can be transmitted through ice cream. You may catch a cold from her, but not HIV. No, any virus. Perfect. You may catch a cold or other virus from her, but you won't catch HIV. HIV is a blood-borne virus, which means that it can only survive in bodily fluids like blood, semen, and vaginal fluids. It is transmitted when one of these fluids comes into direct contact with your blood through sores, cuts, or thin membranes.
Which of these activities would you consider to be high risk? Sharing a cigarette with a friend, sharing an intravenous drug needle with a friend, sharing a drink with a friend. Perfect. Never share intravenous drug needles. HIV is a blood-borne virus, which means that it lives in blood. If your friend is HIV positive, small particles from her blood can remain on the needle. When you insert the needle into your skin, the virus can be injected right into your bloodstream. If you are an intravenous drug user, what can you do to reduce the risk of acquiring HIV? Never share needles and syringes. Kick the drug habit. Use condoms. All of the above. That's right. All of these things will reduce your risk. Of course, the best way to reduce your risk is to kick the drug habit entirely. If you can't, don't share your needles and syringes. This minimizes the chances that someone else's infected blood will be injected into your bloodstream. How is HIV transmitted by sharing intravenous drug needles? Blood stays in the needle and is injected into the next user. The needle sticks allow airborne viruses like HIV to enter. Correct. Blood from a previous user can cling to the needle, where it is injected into the next user. Since HIV is a blood-borne virus, the blood that remains on the needle may contain HIV. If someone else uses the dirty needle, the virus can be injected directly into the bloodstream, causing infection.
Sean shares an office with a woman who is HIV positive. Should he be worried about becoming infected? Only if they have unprotected sex or share intravenous drug needles. That's right. The office is like any other place Sean spends his time. If he engages in high-risk activities like having sex without a condom or sharing intravenous drug needles, he should be worried about becoming infected with HIV. He cannot become infected through casual contact like breathing the air or touching a coffee cup.
What is one way you can become infected with HIV? Working with an HIV. That's right. If you use intravenous drugs, you can become infected with HIV through a contaminated needle. Working with or sharing the bathroom with an HIV-positive person does not put you at risk of acquiring the virus.
Which of the following is no longer a main cause for HIV infection in the U.S.? Sharing intravenous drug. Good. HIV is rarely transmitted through blood transfusions. Although we hear of people who became infected with HIV through blood transfusions, most of them were infected prior to 1985. Today, extensive screening programs are used to detect the presence of antibodies to HIV in the blood supply. Although the screening programs are not foolproof, the chances are now remote that a person would become infected with HIV through a blood transfusion.
Can dogs or cats carry HIV? Yes, but they can't get AIDS. Correct. HIV is a human virus. It cannot survive in other animals. There are similar viruses such as feline immunodeficiency virus, or FIV, which survives in cats. These viruses are not transmissible to humans.
What does it mean to be HIV positive? Antibodies to HIV are present in the blood. The patient correct. The term HIV positive means that antibodies to HIV have been found in a patient's blood. These antibodies are produced by the body's immune system in an attempt to fight off the infection. In most cases, it takes between 3 and 6 months to produce enough antibodies to cause a positive HIV test.
You've answered 20 questions and almost all of your answers were correct. Keep on going.
How can you tell if someone is HIV positive? They exhibit the symptom perfect. You can't tell whether a person carries HIV. Many people who are HIV positive carry the virus for 10 years or more without exhibiting any symptoms.
If you are HIV positive, which of these activities should you avoid? Talking with friends? Eating in public restaurants? Good. HIV positive people must not donate blood. Since HIV is a blood-borne virus, the donated blood could not be used. Casual contact does not allow the transmission of HIV, so there is no reason an HIV-positive person should avoid contact with others. Can you tell if someone is HIV positive by their appearance? Perfect. People with HIV may look and feel fine for many years after being infected. In fact, HIV can live in a person's bloodstream without causing any symptoms at all for more than 10 years. Only a blood test can determine whether a person is HIV positive or not. Which of the following statements are true? People who are HIV positive have AIDS. Symptoms of HIV, that's right. Many people don't show any signs of HIV infection, particularly in the early stages of the disease.
How can a baby be born HIV positive? Through poor prenatal care. The virus can be passed from mother to child. Hospital personnel can infect the child at birth. No. The virus can be passed from mother to child during pregnancy. That's why it is so important for HIV-positive women to avoid getting pregnant.
George's HIV test was negative. How can he confirm his results? Repeat the test at another lab. Repeat the test after 2 weeks. Repeat the test after 6 months. Ask his recent sexual partners to be tested. Correct. To be sure, George should repeat the test after 6 months. During the 6 months between tests, George must avoid high-risk behaviors such as unsafe sex and intravenous drug use.
What kills most AIDS patients? HIV infection. Good. The weakened immune system can't fight off opportunistic diseases and infections like cancer and pneumonia. These diseases eventually kill many AIDS patients.
What is an opportunistic disease? A disease that is caused by HIV. Good. An opportunistic disease is a disease that takes the opportunity to infect the body when the immune system is very weak. HIV attacks the human immune system, weakening the body's defenses against infection. The weakened immune system allows opportunistic diseases and infections like pneumonia and some forms of cancer to take over.